case which came to me. The patient came to my clinic complaining about there's a white patch on my tongue, doctor. It is since I have this since 2 to 3 years. I'm trying to scrape it, but it is not going. Can you scrape it for me? This was the initial words patient has told regarding the case. After examining, and then I confirmed with my initial diagnosis itself that this is leukoplakia. As we all know, leukoplakia is a potentially malignant disorder, which is like a high risk category, which comes under high risk category. As a patient, why did you come before, 2 to 3 years before, when it started to come, he had no answers for it. He told, I thought it will go away, I couldn't, it was not bothering me. So that was the main answer. I thought, why did you come now? It was someone in the relative or something in the marriage who had saw that and then advised me to go. So this lack of awareness maybe. After that, I started asking about his history. Then there was no pan chewing or any tobacco habit, or there was moderate alcohol consumption was there with the patient where he gives history of, and he stopped smoking 1 or 2 years before, and he was smoker before, but not that much more into smoking also, as he gives a history, but I really doubt it. And I have treated a lot of cases of leukoplakia in the buccal mucosa, maybe on the also on the palate and labial mucosa. But on the tongue, this treating on the posterior part of the tongue, lateral part of the tongue, it is a tough one. So I started taking all this medical history and then performing all the medical tests, and everything was normal. So then I went on with the biopsy for the case. I planned for the biopsy for the case, in the clinic itself, with diode lasers. It was a tough decision for me to take. And also I didn't want to send the patient with no answers. And also I didn't want patient to give bad answers and send also, that would be a bad example. So it was all tough nut to crack. Started with the initial infiltration injections with lingual nerve block, INAB. Took all the basic protocols, used indolase lasers, dual wavelength therapy, 400 nanometer tips I used, as I explained in the surgical video also. Beautifully came, and I can proudly tell this is maybe the first case, or maybe one of the few cases in India or in Asia where the patient is being treated or excised, the complete excision of the lesion, which is about 10 to 15 millimeter, has been done off posterior part of the tongue, lateral part of the tongue, under local anesthesia, with OSMF, with limited mouth opening, with gag reflex. Very challenging, and the outputs are amazing. This being 9th month follow-up for the patient. Has come on the 8th or 9th month. Beautifully come. I shall share all the images of post-healing images. So this is the best output of laser till now. My previous difficult case was soft tissue laser, soft palate. It was soft palate, and that was the different case in different scenario. But this was the lasers of posterior and lateral part of the tongue. So you can see this case of leukoplakia doing under local anesthesia of lasers. I have marked the boundaries and all. And this is disposable tips of lasers, 400 nanometer tip. So I have completely marked, and this is after 40 minutes of surgery. There's not even single bleed points or anything which is seen over here. There's not even a single blood drop coming out of it. So this was completely different case. Mouth opening is limited. See, you can see the mouth opening. There's no bleeding spot. So this was after 30 to 40 minutes of case. I couldn't record it while starting the case. So this came out very brilliantly, and there's no bleeding spot. And then I have completely removed that entire tissue, and you can also see the post results also. Complications I couldn't able to record it, but I will definitely update. I'll definitely update it in my next other videos. So this is like during the surgery pics, and this is after it, like around like it is around 10 to 12 mm. And this is after completely removal of the tissue. Like these are the images of the complete removal. So there are little scars to control bleeding. And this is sent for like the biopsy where it came as dysplasia, leukoplakia with dysplasia. This is beautiful image of healing after 6 months, where completely healed, and there is no signs of any recurrence or something, like even after 9 months. So I'm gonna follow up till 1 year, 2 year, 3 years to record this case, and then thank you.